Let's do a Vit-l-escence Build-A-Tooth using two shades. We're going to use one dentin shade, A2, and one enamel shade, Pearl Neutral. And in case you're wondering what you see here, this is my universal opaque shade. It's Opaque Snow. I use it in almost all of my anterior restorations where I have tooth structure completely missing, whereby the darkness from within the oral cavity could play into the final shade of my composite. So this is my white canvas to paint on, and I've created these cuts in the Opaque Snow before I cured it so that it will allow my more translucent shades to go into this area, thereby giving me some really nice detail at the incisal edge. I'll start out with the A2 dentin, and like I said, this is just a good universal shade. I think it's everybody's favorite shade. And we'll take an increment of that. We'll start up here at the gingival 1/3, push it up onto the handle. A nice transition between handle and the rest of our project here. And then we're going to start pulling it towards the incisal edge. And it's that pushing and pulling action that's more effective when you're working with composite. When you start doing this right here, just an up and down patting motion, it creates air voids in the composite that then when you go to polish, then you're having to take care of those as well. And that's just a waste of time. So we want to avoid that. Alright, so let's bring it towards the incisal edge. A little gap right there. Let's use some wetting resin, just a dab of wetting resin. We'll smooth that area out. Nothing like a clean gloved finger when you have something like that. Just put some, use an alcohol 2x2, clean your gloves up, and feel free to jump in there and smooth out your composites with your fingers. Now let's go ahead and cut that dentin shade back, and I'm going to also create some depressions in the dentin. Again, we're building in dimension because we're going to be putting enamel on top of that, and it's going to give us more depth. Okay. Cure. And these composites are relatively photosensitive, which is good. That means we can do composite restorations in deep areas and know that that composite's going to cure. So now let's take our enamel shade. And again, I'll start at the gingival 1/3, place it on there, and we'll just start pulling it towards the incisal edge. Now we're going to get some nice incisal translucency here, simply because we cut back our opaque lingual layer and we also cut back our A2 dentin shade. Let's use some of that wetting resin and smooth that out just a bit more. And I actually do this in practice. I'll wipe my glove off, get a dab of wetting resin, bring it in there, smooth things out, and then we go in there and cut the excess off. Okay, so we'll smooth out this edge a little bit more. Of course, we can also do detailing with our high-speed handpiece. Let's just create some depressions here on the facial surface. And those are developmental depressions that are breaking up those developmental lobes, right? Just like we see in most natural teeth. And of course, if you forget to do this, you can do it once you cure the composite. You can do it with your high-speed handpiece and a nice finishing burr. All right, so let's go ahead and cure that. And then I'm going to take it out of the mold. I'm going to cure the lingual surface of my handle, because that was a rather large increment of composite, so I know from experience it's going to be just just a little bit tacky here. All right, so here's our first look at it. Still got our flash. Can use a bit of jazzing up with our high-speed handpiece, so that's what we're going to do. That's what we're going to do right now. I'm going to use this nice finishing burr. And the finishing burr is going to remove the flash. It's going to start smoothing out the composite. It's also going to leave some texture behind for us, which is what we want, because most natural teeth have texture. If you do happen to run into a patient who has that perfectly glass-like finish, I'll show you a different technique on how to polish so that you can also achieve that. So let's just go over the facial of it, emphasize those developmental depressions. I think some people also call them mamelons. Go over the incisal edge. Okay, now we're going to go over it with our Jiffy brush. And remember, the Jiffy brush already has the polishing agent in the bristles. So we don't have to use paste. We don't even have to use water with this. Just remember, light touches. I like to do high RPM and a light touch. And it will preserve your microanatomy. So unlike a disc that would wipe out pretty much any anatomy or microanatomy that you had incorporated into your tooth, this leaves it just like you wanted it. So high RPMs, light touch, that's the way I like to do it. Also have your assistant use her high volume suction, because that introduces a cooling agent right there to ensure that you're not creating heat on this tooth. You always want to remember that. With any rotary instrument, there is the potential for creating extreme heat. Polish that incisal edge. Okay. So let's put it against the black background. There we go. And what we're looking at is we have some real pretty optical dimension, which is what we're looking for, because that's what nature provides for our patient's teeth and our teeth. And we're also looking for that white line at the incisal edge, which we have here. It's very subtle. If we wanted more translucency, we can cut our opaque shades, such as the opaque snow, or our dentin shade back more and let the pearl neutral or whatever enamel shade you choose to fill in more of the void, and that gives you that beautiful translucency. So you can see the black coming through. Well, that's very much what happens in the mouth. You have that darkness from within the mouth that's coming through, and it's giving you that enhanced incisal edge. So the incisal third, see more of a grayer tendency right there. That's the translucency of a natural tooth.